Welcome to the CJSON podcast. My name is María de las Mercedes Noriega, and I am a pathology consultant at the nephropathology section at the University Medical Center Hamburg in Germany. I am accompanied by Faeq Husain-Syed, who is a consultant in nephrology and critical care medicine and associate professor of medicine at the University Hospital Gießen in Germany. Faeq and I will be discussing our recently published paper on kidney biopsy findings in patients with COVID-19 or after SARS-CoV-2 vaccination. Kidney involvement is a common complication of COVID-19 and is associated with higher mortality. As mass-scale SARS-CoV-2 vaccination rolled out worldwide, there has been an increasing number of reports describing new onset or reactivation of immunologically driven kidney diseases in temporal association with vaccination. In our study, we aim to further understand vaccination and COVID-19 associated kidney diseases.
We analyzed 42 native kidney biopsies, which included 27 biopsies of patients with kidney disease temporarily associated with SARS-CoV-2 vaccination and 15 biopsies from patients diagnosed with COVID-19 between September 2020 to October 2021.
In all cases, biopsies were performed because of an increase in serum creatinine or new onset of proteinuria. In the vaccination group, we found that glomerulopathies were more common than tubulointerstitial diseases. In contrast, in the COVID-19 group, acute tubular injury was the most common kidney pathology, followed by thrombotic microangiopathy and necrotizing glomerulonephritis. It is noteworthy that both groups showed similar kidney function recovery rates.
In the literature, the temporal relationship between the SARS-CoV-2 vaccines and kidney diseases has been explained by multiple mechanisms, including molecular mimicry between the SARS-CoV-2 spike protein and self-antigens in the kidney, T-cell mediated podocyte injury, or a transient systemic pro-inflammatory immune or complement response, which might provoke or unmask underlying autoimmune diseases in predisposed individuals. It is noteworthy that we saw thrombotic microangiopathy only in the COVID-19 group. This might suggest that there are differences in the pathogenesis of COVID-19 associated kidney disease versus after vaccination, such as endothelial injury, microvascular thrombosis, and stronger complement activation following infection.
We did not detect any change in the overall frequency of necrotizing or pauciimmune glomerulonephritis, thrombotic microangiopathy, or primary podocytopathies between the pre-pandemic period in 2019, the COVID-19 pandemic period in 2020, and the SARS-CoV-2 vaccination period in 2021. Our findings indicate that if there is any association between vaccination and kidney disease, it is very rare, given the millions of people vaccinated.
Finally, we would like to thank the co-authors, medical and laboratory staff for the contribution to this work. We hope you enjoy reading this article.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.